I see everyone is logging in. Good to see everyone joining today's workshop. So welcome to the Mountain and Upper Plains Early Care and Education Facilities Workshop. It's sponsored by the Federal Reserve Banks of Kansas City, Minneapolis, and San Francisco, the Administration for Children and Families, Regions 8 and 10, and the United States Department of Agriculture, Rural Development. I am Rob Grunewald, economist at the Federal Reserve Bank of Minneapolis. The Fed is responsible for regulating the flow of money and credit in the economy to achieve stable prices and maximum employment. We supervise many banking organizations and provide a variety of payment services to financial institutions in the US government. The Federal Reserve's outreach and research work in early care and education is housed in the Fed's community development function, which promotes the economic resilience of low and moderate income individuals and communities. The Fed, ACF, and USDA came together to host this meeting since our regional offices cover the 6 states represented here, and we're all involved in some way in supporting the early care and education sector through research, information sharing, technical assistance, and the case of USDA, facility financing. We recognize there are many similarities across these 6 states and the tribes in this region, particularly large rural areas, and it's likely a solution that works in one community may be of value to another one. Each of our organizations hear regularly from leaders in the states and tribes in this region that the availability of affordable quality childcare is a top economic development concern. And within childcare, facility development and financing is a key issue. We recognize that childcare projects don't move forward in isolation. They often include some mix of representation from government, early care and education, economic development, community development financial institutions, banks, business groups, and philanthropy. And all of these sectors are represented among our attendees today. So here is today's agenda. We will hear from representatives of Administration for Children and Families and USDA Rural Development. We'll then turn to the Innovative Facility Projects panel. And at 3 o'clock Central Time, you'll have the option to join one of the 4 breakout room discussions on the topics listed here. In terms of housekeeping, during the first hour, please keep your audio muted and video turned off. Use the chat box to share ideas and resources and to ask questions of speakers. We will reply to questions in the chat with either written responses or we will answer them live during the last part of the panel discussion. The first hour of today's workshop will be recorded and we will send you a link to it afterward. The breakout discussions will not be recorded. And now I'd like to introduce Nikki Hatch, Regional Administrator with the Administration for Children and Families. Nikki.
Rob, thank you so much. Everyone, welcome. On behalf of all of us, and especially the Administration for Children and Families, I'd like to welcome you to our Mountain and Upper Plains Regional Workshop on Early Care and Education Facilities Funding. As you all know, having physical spaces that work for providers and children is essential. It's essential for safety, having enough space and the right equipment, enough space for the number of kids who are being cared for. It's essential for high quality learning environments with inspiring indoor and outdoor environments. And it's essential for the well-being, both of kids and the adults who work there and their families. There's funding now to support providers to create functional, safe, and really wonderful, inspiring learning environments for kids. As we all continue to navigate and recover from the pandemic, solving the facilities challenges that providers are facing is essential to strengthen the existing childcare infrastructure to meet the increasing demands for childcare for working families. Quality childcare facilities are a crucial part of recovery for providers, for families, and for the economy as a whole. And as you all know, the needs and the opportunities in rural communities are unique. So what are we aiming for in our time together today? The goal of this convening is to bring together cross-sector partners who Rob identified and to share your ideas about what's working, what the gaps are, and how we might work together to increase providers' access to resources, particularly in rural areas. Okay, let's jump in. I am so pleased to introduce you now to our 2 first speakers, Melissa Brodowski and Joaquin Altoro. Melissa is our Deputy Director of the Office of Childhood Development at the Administration for Children and Families. In this role, she provides leadership and guidance to support early childhood initiatives across all of ACF. She has over 20 years of experience working in the fields of health and human services, and through a variety of federal positions has overseen grant programs, technical assistance, research and evaluation activities, interagency and regional office coordination, and public-private partnerships. She's also a fantastically smart, good-hearted person, and I've been so pleased to have her as a colleague for my 5 years of federal service. After we hear from Melissa, we're going to kick it right over to Joaquin Altoro, who is the newly appointed administrator for the Rural Housing Services in the U.S. Department of Agriculture. The Rural Housing Service offers a variety of programs to build or improve housing and essential community facilities in rural areas. Mr. Altoro has an extensive 30-year banking career in both residential and commercial lending, and he served on numerous boards and advisory committees to help rural and urban populations meet their unique economic development needs. Most recently, he was the CEO of the Wisconsin Housing and Economic Development Authority, where he strategically positioned that agency to leverage affordable housing in a more holistic way to grow economic prosperity in all types and sizes of communities, in particular for marginalized communities that have been underserved for decades. So let me be the first to welcome Melissa and Joaquin to our conversation. Melissa, let's start with you.
Great. Thank you so much, Nikki, and just such a kind introduction. Nikki's one of my favorite people as well at ACF. So anytime she's throwing a meeting, I know it's going to be a good one. So I do appreciate that. So just a quick, by way of introduction, I think folks might be familiar with ACF's Office of Early Childhood Development, but I bring greetings from our Deputy Assistant Secretary, Katie Hamm, who is unable to join. She has a little thing called Build Back Better that she's working on, pretty busy right now. But we really work across offices within ACF, as well as with our federal agency partners. So I'm so excited to be here with Joaquin to really say a little bit more about this partnership that we started with USDA Rural Development, actually more than a year ago in 2020. And so I'll just say a couple of words, a little bit about the history and how that partnership came about, and then just say a little bit about the resource guide that we worked on together. But the important piece is just, I'm so excited to hear about the innovations that have been happening across the country to really do this work, which isn't easy, but so critically important. I would say the Office of Early Childhood Development really started hearing a lot from the field. Really back in 2019, we also worked with the Office of Regional Operations on some regional childcare roundtables, and a common theme that came up was the need to have additional resources to support facilities. There have been a number of reports that also came out that a lot of facilities across the country were in need of upgrades and repair and renovation. So there was a lot of interest within our office to think about what we could do to provide some resources to the field. So we reached out to the rural development at USDA. They were very excited to partner with us and really think about the kinds of resources, especially through their community facilities programs. And as you'll hear more about other programs and loan programs that are actually available for early care and education providers in the field that maybe people aren't as familiar. So that is really the growth of it. We're excited that we developed this resource tool to be responsive to what we were hearing from the field, and also very timely where we are now. So Nikki already shared all the reasons why access to high quality, affordable childcare is really important, and facilities being a really, really critical piece of making sure that happens and those environments. So if we go to the next slide, the piece I wanted to share was that there have been, as folks are familiar, some new resources that were made available through the American Rescue Plan Act. People have probably heard about the childcare investments and the new stabilization grant program that actually has funding that may be used for facilities maintenance and improvement. And for tribes, there's actually an ability to construct new facilities with some approval from the Office of Childcare. And then within the $1 billion that was provided to the Office of Head Start for Head Start programs, it's really addressing response to the pandemic, but also can be used for facilities renovations, health and safety, creating new outdoor learning spaces, and other opportunities that are available through that funding stream. So that exists now, as well as some other authorities that had existed in the programs. And then we're excited about the possibility with Build Back Better coming on. I think if you go to the next slide, what we tried to do with the resource guide, really pretty beautiful picture there, that really brings together, our whole goal was to really give that useful information about existing, thanks Rob, you can go to the next one, existing resources that are available now. So the resource guide doesn't include American Rescue Plan funding or new funding, but it actually includes the current ongoing funding that's available across different federal agencies. We definitely focus on ACF programs as well as USDA, but there are other resources available there, and really thinking about the needs of rural communities and tribes. So if you go to the next slide quickly, there's a list of the resources, there's considerations. As you heard from the earlier comments, this really is cross-sector collaboration work that needs to happen to really make these programs successful and these projects successful. So there are some innovative approaches and success stories, as well as other links to resources that are helpful. But I think part of what we're also learning is this is, one tool. There actually needs to be more capacity building, technical assistance, really working with communities to think through how to even do those construction projects, which is something that often many early care and education providers, directors, they don't have time to sort through that complicated process of trying to think about financing and renovation and constructing new facilities. So we feel like this is a starting point. And I think, Rob, if you go to the next slide, the hope is that we launch this resource guide in September. We're so excited that Regions 8 and 9 partnered with the Federal Reserve. This is the kind of conversation we actually hope happens across the country. But Nikki's always the early adopter, so she's the first region to want to really try to have these conversations, to really bring a group together to think more thoughtfully about how to use these kinds, the information that's here. So we have it available in English and Spanish. I think that might be the last slide, Rob. And I know there'll be more discussion, so you can skip that part, but I'm just so pleased. I will have to say the rural development team has been so on board. I know there are folks that here helping with the small groups, and we really want to continue that partnership to really hear from the field about the kinds of support and technical assistance that may be needed and additional follow-up information. And with that, I will turn it over to Joaquin, who I'm so excited to hear from with the work that he's now leading in rural housing. Thank you.
Good afternoon. Thank you very much. And I appreciate the shout out to the rural development team. A lot of folks working a lot of hours. I think everyone understands that COVID really hit our children hard. And so this is a very relevant and very important conversation. So I thank you all for this opportunity to share with you today. And I got a lot of information to get through in a limited amount of time. So forgive me in my quick speak, but I will speak with clarity so that I can get as much information to you all. And so under the leadership of President Biden, Vice President Harris, and Secretary Vilsack, USDA is deeply committed to helping rural and tribal communities build back better by strengthening childcare infrastructure and by meeting the increasing demand for affordable quality childcare for working families. The realities of childcare in rural America, I think is real important for folks to know, is that the unique characteristics of rural communities often contribute to some of the childcare and early learning challenges faced by rural families and service providers. Fewer choices, childcare and early learning options can be limited in rural areas. Limited transportation options, lack of access to reliable transportation options, lower population density, which means there's an offer of fewer childcare centers and providers, fewer skilled service providers. We have that conversation about workforce recruitment and retainment, Lower incomes, so high cost of childcare places many options out of the reach for lower income rural families, very expensive. So childcare and early childhood development resources through RD. Health and Human Services Administration for Children and Families and USDA Rural Development are collaborating to encourage investment in high quality, affordable childcare and early learning opportunities, because this is a critical component of building and strengthening economic prosperity in rural communities. Bolstering childcare options and increasing the supply of childcare and early learning facilities is fundamental to revitalizing rural communities in the rural economy. USDA Rural Development primarily supports center-based childcare facilities. It can support certain home-based childcare that meets program eligibility requirements. Funding from specific USDA RD programs can be used to offset costs associated with new construction or to renovate or expand an existing building, plus cover the cost of equipment, furnishings, and utilities necessary to support childcare in rural areas. Interested stakeholders can inquire about these programs through their USDA RD state offices, and state and local office staff are committed to rural prosperity. They live and work in the communities they serve and understand your needs and challenges well. Our community facilities programs provide long-term, fixed-rate, low-cost direct loans or loan guarantees to commercial lenders to help finance essential community facilities in rural areas. Grant funds typically are used to purchase necessary equipment and vehicles in support of essential community facilities and services, including childcare and early learning centers. The Rural Business and Cooperative Service offers programs to help businesses grow, as well as support job training for people living in rural areas. The B&I Loan Guarantee Program bolsters the availability of private credit by guaranteeing loans for rural businesses and communities with populations up to 50,000. Rural business development grants can be used to acquire and develop land and buildings, to purchase equipment, and even to build or improve access roads, parking areas, utility extensions, water and waste disposal facilities. So really important to know kind of the diversity in where we can support. USDA's Child and Adult Care Food Program is a federal program that provides reimbursement for nutritious meals and snacks to eligible children enrolled for care at participating child care centers. There are also opportunities to knit USDA programs together with Head Start, child care, and community services programs for early care, offered by the Administration for Children and Families, ACF, at HHS. This collaboration provides a unique opportunity to help address the needs for childcare facilities and infrastructure in rural communities. The ACF, Office of Head Start, and USDA's Rural Housing Service also have an Inter-Creditor Agreement. The purpose of the agreement is to help Head Start grantee interested in expanding or building a rural early childhood development facility access affordable long-term financing from USDA Rural Development's Community Facilities Program. The Inter-Creditor Agreement facilitates the management and coordination of the respective laws, regulations, and policy guidance governing USDA's Rural Development Program and HHS ACF's Head Start program. It allows Head Start grant funds to be used to acquire property by making the payment of principal and interest in satisfaction of the USDA loan. The best way to get started is by talking with the program's assigned program specialist via the official Head Start enterprise system and working with your rural development state office. If you're not already a Head Start grantee, ACF has the resources to help you become one. More information on the USDA, rural development, and ACF programs can be found in the Joint Child Care Resource Guide that was spoken about before. And you know that's available at the Rural Development's website. And so kind of a quick success story. And this is a developing Head Start, early Head Start and child care centers to serve tribal communities. Tribes face unique challenges in financing capital improvements for community facilities, including child care facilities. Each tribal entity has different needs, and both USDA RD and HHS ACF staff can assist with tailoring a financial solution to support critical childcare and early learning options that work best for their children, their families, and their community. USDA RD partnered with the Red Lake Nation in Minnesota to finance $11.3 million in improvements at the Red Lake Nation Tribal College campus. Financing was provided through USDA's RD's CF, our Community Facilities Direct Loan Program. The new 42,000 square foot facility boasts a daycare center designed to accommodate single parents and families seeking to further their education without the stress of having to find off-campus childcare. A kitchen is included to provide meals for both college students and children at the daycare. A primary goal of the physical expansion and additional virtual learning options was to afford students the opportunity to earn four-year degrees without leaving the Red Lake community. On-site childcare ensures these educational opportunities are equally available to students with young children, and the quality childcare is available for both students and faculty. These are the types of tailored solutions the USDA is committed to supporting partnership with local communities across rural America. So given the prevailing economic challenges, an innovative way to meet childcare needs is to collaborate with partners in your community. You may have opportunities to leverage existing community infrastructure to meet childcare needs in rural America by co-locating childcare and early learning facilities in those settings, as I spoke of the Red Lake Nation did in Minnesota. I'd like to conclude by saying that childcare is just one of the 100 different types of facilities rural development programs can support. You determine the needs in your communities, and then reach out to our local RD staff who live, work in the communities they serve. Rural development is here to be your partner and help. So thank you very much for the opportunity, and I'd like to pass back to Rob.
Thank you, Joaquin and Melissa and Nikki, for getting us started. I'm going to now move us to our panel discussion. And to get that started, I'm going to share my screen for a moment. And this is just to show you where we'll be moving for the next 40 minutes. And that is, we'll start by looking at developing a successful childcare center project with Melynda Epperson and Justin Bailey. We'll then shift to a discussion more about home-based providers and the facility challenges that they face with Elizabeth Sismaski and Shauna Ryan. Then, to learn more about the role of community development financial institutions in this space, we'll talk with Heidi Hagelbraid. And then what I think will be a fascinating discussion about a state government agency that's supporting childcare facility development with Jessica Nygaard. So we'll get started here with Melynda and Justin. I'll let you come off you can show your video and come off audio.
Hello.
Hello. Hello, Melynda. Hello, Justin. So Melynda Epperson is the Director of Human Resources, Fiscal and Development at the Evanston Child Development Center, Children's Learning Foundation. Justin Bailey is RD Architect and Environmental Coordinator with USDA Rural Development. We'll have a chance to talk about your project. We'll start with Melynda. So if you could just briefly start by describing your program and location.
Absolutely. I'm Melynda Epperson. I'm in Evanston, Wyoming. I am one of the directors of our local early ed programs here. We have programs for children birth through 12, and we're currently working on a new facility to replace our birth through 3 building, which is a 45-year-old modular that is way past its useful life. It was never intended for young children. And so at this point, we're just super excited that we've started a new facility.
And can you talk a little bit about how you came to the decision of why to build a new one?
So due to the fact that this modular was never meant to last 45 years, we decided we needed to start with a building assessment. And so we brought in professionals, architects, construction experts to assess this current facility, and found that we had more critical issues than than we were aware of. And those critical issues were going to cost approximately $1 million to rectify. And we knew that was not something we wanted to pursue in a modular facility. The facility that we're in was grandfathered in as far as building codes. We don't have an alarm sprinkler type system for fires, just a lot of things that this building, it just isn't adequate for young children. So instead of spending $1 million to upgrade, an aging modular facility, we decided to start pursuing a new facility. And so we looked at our community needs assessments over the years and saw the trend and the need for more classrooms for infants and toddlers. And we talked to early childhood experts, we talked to our community leaders, lots of board of director discussions with our staff, teachers, our families. And we all came to the conclusion that the best option for us was to build a new facility.
So after you made that decision, what resources did you use to inform your process for the design of the facility?
Well, in the beginning, we were really green at this, even though I had some construction experience. We started, Google. I started doing a lot of Google research and then visiting other early childhood education facilities across the country, calling directors of facilities that were newly constructed, asking questions of what did they like, what would they do differently. I spent a lot of time talking to our teachers, saying if you could design your ideal classroom, what would it look like? We found several online resources. The Office of Head Start does have a design guide. There was a guide from the local initiative Support Corporation that we found very useful, and then found an architect who was willing to help us and had built several school facilities, but mainly, K-12 type facilities. And he was willing to jump on board and help do the research with us. We brought in our local child care licensor and just got started.
That's great. And so along the way, how did you incorporate parents and community feedback into the design process?
So our parents and families are very important to us. So we started with parent surveys and basically just asking them, what's your ideal classroom look like for your child? And just really listen to them. And we've had a committee, for quite a few years now that's involved community leaders and members and families that helped us determine what our needs were and what the best facility would look like.
And in terms of financing, how would you describe your financing package or strategy?
That's probably the biggest obstacle. We started fundraising, like 10 years ago, putting money away every chance that we could. And we obtained some funds from local and regional foundations. The Office of Head Start provided some initial funding for feasibility and architectural design. And we were hoping that the Office of Head Start would provide additional grant funds. However, that hasn't been the case. So we started to get a little panicky and stumbled across the USDA Rural Development Program and started working with those folks here in Wyoming and have obtained a loan from them. And it's been a lot of work, not going to sugarcoat it. It's a lot of work. And the funding has probably been the most stressful part of the whole project. And we are still working on funding for the second phase of the project. The second phase of our project will be tearing down the existing modular and then building over that land so that our building is actually big enough to expand. And still working on funding for that.
Great. Well, thanks for that overview. That's a lot of information to share in a very quick amount of time. I'm going to move to Justin, who served as the USDA architect on this project. And I know that the design came from the with the work that Melynda and her group were doing with the architect originally, when you found this design, what would you say are 2 or 3 features that were unique for a childcare center that is different from other commercial projects?
Yeah, thank you, Rob. This was, yeah, like you said, RD came in after this was designed, so I kind of got to see the full picture. I didn't get to the design, development, all the heavy lifting that Melynda and her team went through, but this is my first one in 15 years I've ever done, so not very common for a childhood facility. One thing I thought that was interesting is the supporting rooms. She talked about isolated, or the classrooms, more need for classrooms. And I thought that was pretty unique because they developed it where, you know, you have your restroom, changing room, prep laundry room. You have its own glass entry for viewing. And it's really a set up one area, so they're not running all over the place. So I thought that was pretty interesting. I call it supporting self-contained type of rooms. The other one I did was a design criteria that I came up with was the 75 square foot per child on the playground space. So they had 75, they programmed that for 75 square feet a child, but then also the direct access to those playground space. That's a pretty challenging design criteria, especially for an architect when you're planning on a limited site or an existing site where not only are you in this case, you're not only building a new facility, but you also are kind of competing with an old facility and space room for it. So the other one is like I said before, the ties back into the support rooms is the self-contained. You know, you got the restrooms and the sinks all over one classroom. You got several classrooms throughout the building. So it's really unique concept where they don't have to be running around. You have the ones there and looking out for the kids, and they're all isolated, or not isolated, but all in that same area. So pretty well thought out. You can tell they took a lot of time into developing the space, and it's a good facility.
Great. And what advice would you have for an organization that is considering to working with an architect on a childcare facility?
Well, I think Melynda hit it right on the head. She said she found an architect that had some experience in that. I can't say that all architects out there will have experience in a child care facility or K through 12 facility. That's pretty important. That's knowledge you can't teach. That's something that someone's gone through. So that's probably my biggest advice right there. The other one is the actual guidelines. So one of my first questions to the architect, the designer, was, so what did you use to guide this design? There has to be something out there that had to give you some pathway. You know, they listed off the Federal Head Start Facility Design Guide, National Association of Education Young Children and Caring for Our Children. Those are guides that they use to help with their design criteria, and that's huge because that gives you a path forward. You don't usually have to stick with them unless there's a regulatory agency, licensing agency that requires things, but at least gives you a head start so you're not just working from scratch and spinning your wheels. And then designing the requirements of licensing facility or agencies, like Melynda said, and childhood development programs. That's you don't want to get to the end and feel or realize you didn't get it right on the mark. So I think those are some of the ones I take away from that.
Great. Well, thank you, Justin, for that advice.
Yeah.
So now we're going to switch from center-based providers, and we're going to move our discussion to home-based providers. And to join us on this conversation is Elizabeth Szymanski, who's the co-founder and CFO of My Village, and Shauna Ryan, who's program owner of Three Rivers Childcare in Bozeman, Montana. And we'll start with Beth on these questions. The first is just an opportunity to describe briefly the work of My Village.
Yeah, thank you so much for having us. This is quite the opportunity. So we are the fastest growing national network of childcare providers in the US. We currently have about 15,000 members, and we are adding hundreds more each day. We are essentially a fintech platform that helps providers unlock the benefits and resources that they need and, to be honest, that they deserve. But we got started about 5 years ago by building around 200 licensed home-based programs in Colorado and Montana.
Great. So looking at that experience of helping some providers get started, what are some of the common facility renovations home-based providers face in order to open or maintain their home-based childcare business?
Yeah. So I think the biggest ones have to do with, they all have a theme. It's kind of this fencing railing component. So most states have to have fencing in the backyard. And so that tends to be the largest expense. But then also if anyone has deck space in the backyard, the railings can only have slats that are so far apart. Or if you have a bi-level house, then there needs to be railings in between the levels in the building. And those tend to be some of the biggest facility expenses.
Right. And as you saw providers get started, what kind of financing resources do home providers turn to pay for these renovations?
Yeah. I think one of the interesting things, although not surprising, that we found, we work with, when we were first getting started, we were working with both licensed and unlicensed providers and helping them to get licensed. And a lot of the providers who we wound up working with weren't in licensable housing. They were, renting, maybe they didn't have a landlord that was willing to license, or they were an apartment complex. So we actually started trying to help them find housing that they could move into. And what we discovered is that a lot of the applicants had poor credit, or their partners had poor credit. And so, in working, through that, as we were helping people to get licensed, we found that the majority of them couldn't access loans to get started. So a lot of them turned to grants, and I'm sure Shauna can talk about some of the grants that she's accessed during her time. The problem with the grants is that a lot of them, they're not well advertised. They come with a lot of red tape. And, the big thing with the grants is they're often available after the program is started. So you have to find a way to front the funds. We did wind up creating a really interesting partnership with Eagle County in the state of Colorado, where they were willing, we were very good at finding people who want to start businesses, so we could find them. They were willing to, give them some grant funding up front, and then the rest could be unlocked once they receive their license. But what we generally see is a lot of providers wound up taking personal loans from friends and family to get started that then they can pay back with the grant funds.
Yeah, I think that's very useful to help set up Shauna's story here. So we'll turn to Shauna. If you could briefly describe your childcare program, where you're located and how many children you serve.
So I'm located in Bozeman, Montana, and currently I'm serving 6 families, but that is 10 children. So pretty busy.
And I know part of your story already, which is that you at one point you decided that you're going to remodel the garage and make that part of your program. So, what was the situation, or what issues made you decide to make that remodel?
So we had the program directly out of my home for a little over a year before we really decided that home life and work life would be really great separated. It's not just me in my home. I have 2 sons, my husband, and then my mother also lives with us. So, just having the separation, I think, has made a huge difference. And we can go from work to home, and my sons have their own space. But it is really nice because I literally just walk through a couple doors and I'm at work. So
that's great. So when you decided to do the remodel, what resources did you turn to develop the design?
So I work directly with the state to make sure that, we were in the guidelines to make sure the space was up to par. Everything was safe for the kiddos. But to be honest, I did not have any funding to upgrade our childcare space. I'm lucky enough that my husband's an electrician and my brother is a contractor in the Valley. So they did all of the work and provided most of the materials. But without that, I definitely wouldn't have been able to do any of this renovation. And so I did not use funding. A lot of the funding that I've come across, a lot of the grants actually didn't allow to be, you couldn't use those funds for any renovation projects. Hopefully that changes going forward for other providers, but yeah, again, I was lucky enough to have all of that kind of handed to me.
That's great.
Yeah.
So looking, you talked a little bit about this already in terms of how the remodels helped your flow of being able to support the children, you moving to this space that's just for the childcare. As you look at the remodel and see how it's working, what are a couple other ways that the remodels helped you provide high quality care for the children?
Yeah, one of the biggest differences I can see with the separation of a school play space and a nap space. So the children nap inside of my house, but we have the school for awake time. Separating that makes a huge difference for nap time or rest time. They don't feel inclined to, want to play with toys. And it can be a hard cutoff for children because, they're allowed to play with toys all day, or, they're allowed access to certain things all day. And then at nap time, you're not allowed to do that. So having that separation makes a huge difference. And it's nice to have a space that is specific and designed to be a school. I have, a really nice table where everybody can sit around. I can decorate it more like a preschool, whereas my home, I'd like to have my own space separated. I don't want to have posters all over the place if I can help it. So again, just having that separation is huge for my family.
Good, thank you. And then finally, I just want to let everyone know, the attendees, if you want to ask any questions of our presenters or panelists, you can drop them into the chat. We'll have some time at the end to answer those, or we'll just write in some responses. And then finally, I'll just ask, what advice would you have for another home-based provider who's considering a remodel?
Really apply for any and all grants, because I feel that, especially now after COVID, childcare we're hurting. It's hard to do anything, let alone buy new markers or just have the basic necessities. So yeah, grant funding, just go ahead and try to find as much as you can.
Good. Well, thanks a lot, Shauna, for sharing your story, and to Beth as well. And we're going to move now from talking with providers, looking at the center and the home base. We're going to move to the perspective of a community development financial institution. We have Heidi Hagel-Braid, who's Director of Operations at First Children's Finance, which is based in Minnesota, but works across many states around the country. So welcome, Heidi. And I thought we'd just start with, if you could provide a brief description of First Children's Finance work.
Thanks, Rob. Hi, everyone. I'm Heidi Hagel-Braid. I'm happy to tell you a little bit about First Children's Finance. We're a national nonprofit organization located and headquartered in Minnesota. And we work in 3 different ways to build the supply of sustainable and excellent childcare. First and foremost, we work directly with childcare businesses, making sure that they have access to training, consultation, coaching, and capital to be able to finance their facilities and the improvement of their businesses. So as a CDFI, we provide financing to both childcare centers and family childcare homes, or to those entrepreneurs, especially those who have lacked access to capital. So that's why CDFIs exist. So we are really interested in extending capital to folks who historically have not had access to capital. The second way that we work with across our organization is partnering with communities, both urban and rural and everything in between. But since 2013, we've been focused primarily on building supply in rural communities across a couple of different states, really thinking about how to engage communities in meaningful and impactful processes that allow them to leverage the assets of their community to build the supply that they need. And then finally, we work with systems, federal, state, and tribal. We work with about 25 different states. We do partner with the federal government, and we are piloting projects to build culturally and linguistically relevant care of tribal childcare with 2 different Native nations located in Minnesota. So all of that is in service of making sure that childcare businesses are sustainable and that communities have the supply that they need for strong, healthy, and vibrant communities.
So with that introduction, I'll just ask you 3 follow-up questions, one in each area of your work. So looking more at the childcare facility project side, what are a couple of elements that help those projects succeed, especially in rural areas?
Sure. I think if you are looking at starting up any new childcare business or expanding an existing one, it's important for you to understand the right size solution that is sustainable in your community. And for many rural communities, that is going to be family childcare. And to think innovatively about where and how right-sized solutions can exist. One of the things that I hear often is they think, an entrepreneur will say, I know that there's a demand for at least 200 spaces in my community. And overbuilding can be problematic to the sustainability of that business. So you really want to think about the right size solution and then leverage the assets that exist in that community and build for sustainability.
Great. And then thinking about the work at the community level, and I'm familiar that you have a process of working with communities. So what are some effective strategies to promoting childcare supply at the community level?
Yeah, as I thought about this question and tried to distill it down, I have sort of 4 things that I thought about. Number 1, know the precise problem you're trying to solve. What is the gap in the supply? Are you trying to create 12 slots or 1,200 slots? It's a big difference, and there are different approaches to the problem. So making sure that you have a precise understanding about what kind of supply and the amount of supply that you're trying to build is important. The second thing would be to innovate with sustainability in mind. Sometimes we can think about all the bells and whistles and get really excited about a project and not think about the survival of that facility and that project. I was really taken by the presenter from Wyoming who was talking about being in transitional building for 40 years. Think about how you can build for sustainability, and that might mean thinking differently about your project. Really connect childcare. The third thing is really to connect childcare as rural economic development and to bring unusual suspects to the table who you might not think about as potential partners in your project, but thinking about rural economic development. Childcare is such an integral part of the solution to that community, and really, reframing that as economic development can bring more champions in your community to the table who haven't thought about childcare in that way before. And then the fourth thing is to use what you have, and every community has assets. Think about them as the hard and fast assets of capital funding facilities that already exist and could be transformed into childcare. But don't forget about things like social capital, like those unusual suspects might bring to thinking about a community solution, giving you the momentum to access local financing or legislation or things like that to be able to bring that project to life.
And then moving to the system level, recognizing you're working with states and tribes. So what would be one or two things that you've learned from states and tribes about working at this system and helping create a system that's conducive to facility development?
Great question. So at any given time, we're probably working with about 20 to 25 different states, tribal systems, and the federal government. And, as Melissa mentioned earlier, it's a very busy time. When we think about system investments, we immediately think about states and how they can create access to capital and pair that with technical assistance. So how can they make capital available to childcare entrepreneurs, and how can they pair that capital with technical assistance? That's where CDFI investments are really wonderful. And it isn't just financial institutions that can invest in them, state systems can as well. The other thing that I would recommend is that often we think about supply building and facilities as two separate things, and we should. They're connected, but often we use those words interchangeably, and facilities are important and supply building is important, but they're two separate pieces and they're connected. But thinking about supply and facilities in new and different ways that you haven't is really critical. And when a state system or a tribal system in particular can think about ways to be innovative, that is a system response. That's about things like the tool of licensing. What can you license? What facilities can be licensed? How can you think innovatively about that? I know North Dakota is coming up, and I know there's some really great things happening over there. Where can family childcare happen? In what kinds of facilities and how? How can states or municipalities open up bonding to non-public entities like childcare, or make bonding and financing more accessible? Those are all system responses that states should employ, and tribes have even more flexibility when they come to that. So really thinking about things from an innovative but sustainable manner is important, and really thinking about your child care facility investments as a portfolio that should be really diverse and wide is the recommendations for systems.
Great. Well, thank you, Heidi, for all those insights. Now we will transition to North Dakota. And this is looking at the North Dakota Development Fund. We have with us Jessica Nygaard, who's the CEO. And just to start with, Jessica, if you can briefly describe the North Dakota Development Fund and how the Child Care Loan Fund got started.
Yes, of course. And thank you again for having me today. Well, the North Dakota Development Fund was created back in 1898, and it was set up to coordinate efforts between all sources of financing, businesses and communities. Any project considered for financing, we only ask that it must be feasible and have a reasonable chance of succeeding. But the fund, it provides basically a flexible gap financing through loans and equity investments, not available at most conventional lenders, and is available as to any primary sector business with the exception of production agriculture. The fund is a source of financing whose funds can be subordinated to a company's lead lender. If the business can't handle the added debt, then the development fund can take on that equity financing position. So, and then go ahead.
Oh, no,
okay. And then our child care loan program, which is just one of the many programs that we have at the North Dakota Development Fund, was created after legislative session in 2009, which we were appropriated $1.25 million between July 1st of 2009 to June 30th of 2011. Which basically meant out of that 1.25 million that we were appropriated, once it was paid back, then we were able to use those funds as our own to continue it as a revolving loan fund, which it has continued today.
And what types of loans does the development fund make to childcare programs?
Yeah, so first and foremost, they have to be an approved North Dakota child care facility. The aggregated maximum amount that we can fund is $100,000 per facility. And then funding can be used for anything as far as real estate, equipment, or working capital. We tend to see that really to be like 1 to 3 for working capital, 3 to 5 for equipment, or 7 to 10 for years for real estate. Refinancing of debt is not eligible under any means here at the development fund.
And how do you see the child care loan fund fitting in with other financing options that child care providers have access to? That is, how do you describe the gap that the development fund fills in this case?
Yeah, so we're able to be able basically to fill the gap. So we're able to set fixed interest rates at about 2.5% for the term of the loan, as well as being able to be more flexible with our terms and no minimum equity requirements as well for our fees. We also don't base our loans off of any job requirements or things along the lines. So what a conventional lender would look at, we tend to be able to kind of put all that aside, and we basically base it off of the impact that it's going to have on the state of North Dakota. Again, this is why we call ourselves that flexible gap financing company. We're here to help out when and where it's most financials, or basically where a financial situation or financial institution can't. And if they can't be able to handle that added debt, again, that's where we're able to step in and take on that position.
Great. And just to finish up with this question, what impact have you seen that the child care loan fund has had on North Dakota's child care supply?
Yeah, so it was a point that I was going to touch on a little later, but basically the most important is our child care slots that were available when the development fund started with the child care program was around 806. That has now changed to over 3,200, with also adding in 116 full-time employees. And that's just by being able to provide this funding that wasn't there before. And we take that as a huge impact, because by adding in those full-time jobs, we've now taken away from our unemployment rate, and so.
Great. Well, thanks for all this information about the fund. We're going to move to just one quick question for the panelists before we conclude for the session. I see that we have a question in the chat, and maybe I could, if Beth or Heidi are on, and anyone else who would want to talk about this, but I'll look to you for this one. Are there examples of the long-term support created for these programs? That is, how do you develop the sustainability? And maybe I'll turn to Beth first to talk from a home-based provider perspective, and then Heidi will wrap up with the center.
It's a really interesting question, especially when you look at, like, in home-based in particular, earners are in the bottom 2 percentile of workers in the United States. And so this is clearly an industry where we need to have more government resources involved to support the financial sustainability. So one of the things that we've been looking at, here in Colorado, are the Arpa funds, and they're going to be distributing those funds. Lots of states are distributing them in different ways, but here they're going to be used to subsidize the operating expenses for programs. And I think that is it's needed dollars. There are dollars that are being deployed as well for subsidies to paying for childcare, and I think that really helps families. But it actually, a lot of those are based on existing rates, which aren't necessarily based on sustainable programs. And so I like the idea of the funding coming in to support the operating expenses of programs right now.
Great, thanks, Beth. And Heidi, if you want to take that from the perspective of the childcare centers.
Sure. It's not all that of a different response than Beth just mentioned. It is about public investment in childcare and really thinking about how to move the needle on compensation in particular. So in a childcare center, it's not unlike what family childcare also needs. In particular, what's different about childcare centers is that about 60 to 70% of the line item expenses are wrapped up in personnel costs. And still, those folks are vastly underpaid. They're not livable wages. And so what has made childcare quote unquote sustainable up to this point is financing it on the backs of its workers, quite frankly. So what we do need is public investment, and it can't just be in one particular thing. There needs to be robust investments on multiple levels for family childcare and childcare centers, but in facilities, in operation costs, in compensation, a lot of those different areas. And of course, we have ARPA, which is one-time funding, and we're anxiously waiting to see the progression of Build Back Better to see what remains in that bill at the end of it, and see what provisions are allowed into that. The other thing I would just mention briefly is that it's important for states, tribes, and territories to conduct cost of care studies, which get to the heart of what the operational costs are for delivering high quality care. And the subsidy program often looks at it from a very different way with a market rate survey. And the market rate, it just does not cover the cost of doing business. And so having a cost of care and then basing subsidy on that is a movement forward in being able to invest in programs so that additional children are there, but they're getting exactly what they need. Kids win, families win, but also the entrepreneurs win because they are receiving adequate compensation for delivering those services, which is not currently the case in many places.
Great. Thank you, Heidi. I think that provides excellent context to move on to the next part of our program, but just want to end this session by thanking everyone for participating. This has been a very rich panel discussion, and I know that this recording will be available for others to view too, because we covered a lot of ground. So thank you so much. I think we're all making our way back from our breakout sessions. And as we're doing so, I wanted to introduce Leilani Barnett from the Federal Reserve Bank of San Francisco in Community Development, who will close us out with some concluding comments.
Great, thanks so much, Rob. Yeah, my name is Leilani Barnett, and I'm with the SF Fed. I cover the state of Idaho and the Central Valley of California, but this has been a real honor to partner with our co-lead organizations to make this possible. And I just wanted to thank all of my co-partners and co-conveners, along with everyone who participated today and provided all of that excellent information. You know, as Rob mentioned, the reason why the Federal Reserve Bank as a system is so focused on early childhood education and childcare is that it's a really important component and a big contributor to the economy overall. It's an important part of workforce and allowing people to work. And so financing is a big piece of that. The facilities is a big piece of that. And, you know, we heard about some challenges today, and we heard about some opportunities, some programs, some models, some approaches. So I hope that was helpful to you all. This is work that we're going to continue to do in partnership with folks. And if you have ideas of how, you know, other topics that you want more information on, or you want to, you know, work with us further on, we'd be happy to hear about that and continue the conversation, because this really is just overall an important part of the economy, especially in rural areas. So thank you all for participating, for sharing your resources and your expertise, your knowledge. You're really all experts here in the room, and for being with us today. So thanks, and thank you so much, Rob, for taking the lead on all this and all of your expertise.
Thanks, Leilani. And I just want to echo your thanks for everyone joining. And also you'll get an opportunity to reply to a brief survey that will pop up as you leave this meeting through Zoom. And we'd be really glad to hear your thoughts, especially as we think about this work going forward. So with that, we will adjourn and wish you all a great rest of the day.